All right, I think we can go ahead and get started. Thanks everyone for joining today's webinar on Infor's landmark or CloudSuite Benefits. My name is Jake Michael. I'm the Director of Business Development, and joining me is Brittany Johnson, who is a Senior HCM Functional Consultant with Intellias. Brittany, can you go ahead and go to the next slide, please? All right, so here's a quick look at today's agenda. We're going to start with an overview of the module, followed by a look at the reports and utilities, and then finally we'll go into a live demo. So we're going to keep everyone muted. You can type your questions in throughout the presentation, and we'll get to them at the end of the presentation. And since we do only have an hour, this is going to be more of an overview. But if there is anything specific that you'd like to cover, you can follow up with us after the presentation. We'd be happy to schedule a follow-up demo. All right, so here's just a little bit more about Intellias. We're headquartered in Dallas with a technical hub in Chicago. We've been in the Infor space since 1999 and are an alliance partner offering consulting services, both technical and functional, across all the Infor Lawson suite of products. Next slide, please. So at this time, I'll kick it over to Brittany to dig into the actual webinar.
Thank you, Jake. Good afternoon, everyone. As Jake has stated, we will be reviewing the Infor Benefits module in an overview setting. I will be highlighting majority of the differences between Lawson benefits and what are the new enhancements that you will receive with the GHR Benefits module. The Benefits module is a module within the HR Talent CloudSuite HCM product. It offers flexible tracking of employee, retiree, and COBRA participant benefits. Today, we will break the module down into four main processes: the setup, enrollment, maintenance, and reports. Excuse me. The Benefits module offers a more enhanced employee experience compared to Lawson S3 benefits, and we will have a live demo from the benefits specialist perspective and also the employee perspective as well. Here's an overview of the three processes, and we'll discuss each one of these in more detail. First, we'll discuss the setup, which includes defining benefit organization and groups, benefit preliminaries, creating benefit plans, and defining enrollment groups and enrollment rules. As stated again, during the setup, we will review basic setup information, how easily accessible this information is as well. So now I'm going to go into the application live from the benefits admin perspective and review the benefits setup. And we will go back and forth between the slide and actually the module itself. Here we have the benefits module, and we will see on the navigation panel on the left the different options that we have to explore here. And for this particular process, we're just going to refer to the setup. I want to quickly talk about reason codes. Is there something that is also used within Lawson S3? Here the codes can be used interchangeably amongst different types of actions, and they can also be related to different HIPAA reasons and enrollment events as well. Here we set up the organizations, where of course you can have multiple organizations within CHR. And within the organization setup, we define the ACA reporting and the GTL, life insurance reportable income table, and HIPAA reason information. I want to highlight groups as a good topic to discuss. For example, within Lawson, we know that we use the HR 55 to define particular groups, and we run the HR 155 to thereafter pull the reports and review the groups. Here within GHR, we have a particular group here, and this is a simple group that's just looking for all active employees. And of course, we use the builder to add different conditions. Something that I really like within GHR is we can preview all of this information as we're building the groups. And here we can assign this particular group to multiple subjects. For example, it can be used within the occupational health module, the compensation module, or the benefits module. The benefit groups themselves are dynamic, which means they are automatic. There is nothing necessarily needed to run to enroll an employee within that group. Here we have the group, and we have the employees and the members that are enrolled in the group. So we can always see this information. And the remainder of the setup would be basic rate tables, deduction codes, any benefit categories, templates. Templates are something that is a huge win within the GHR benefits module. A template can be created and assigned to an email for automatic sending to an employee for different reasons. For example, we'll see that these particular templates are attached to open enrollment and submitting and finalizing of a life event for an employee. So they'll receive this information within these templates, and that's also done within the setup as well. That was a very quick overview of the setup. However, there are other things that we're going to review in the setup as well. Now I would like to transition to a benefits plan setup. And for today's purposes, I would like to review the HSA setup plan. That plan has really been changed and it upgraded to be more user-friendly within GHR. Here we have the HSA plan. And normally within Lawson S3, of course, everyone knows you would have multiple plans. And within that multiple plans, you would have multiple groups for the over 55 and the under 55. This new setup allows a condensed version of the HSA plan. For example, you may go from 5 plans to only 2 plans. And I'll show you here. So we have the main plan set up here, which encompasses the coverage type, the contribution type, and the frequency table and provider information. Also, any plan documents that you would like to attach to the plan for your employees to view as well. We discussed the benefit groups and eligibility groups as well, and we attach those groups here. Deduction codes, entry rules. Within entry rules, within GHR benefits modules, they're more dynamic because you can have multiple entry rules, and you can also have the different entry rules for the life events. Within Lawson, sometimes the life event change rules wouldn't allow you to change the rules per the event. For example, if there's a birth, of course, you would want the child to immediately be enrolled in the plan that's applicable. We can have multiple termination rules with multiple dates as well. Here we have our contributions, and a lot of this setup is similar to Lawson, but it's all in one plan versus multiple streams. Here we have our contribution set up for the HSA, and here is the item I would like to highlight. Here we have the employee-only maximum, the employer contribution, and we also have a table to attach the family limits versus us having multiple groups here or multiple plans. We have everything that we need right here, as well as the additional amount for the age over 55. So all of that information is condensed and much easier to monitor and adjust as needed. Here we have additional information regarding age, cycles remaining, and other information here. And the deduction codes are just reiterated here again. And here are the enrollment groups. We're going to get into the enrollment groups when we discuss the enrollment events. I just wanted you to see, however, that everything attached to the HSA plan is in one centralized location, and you're able to go back and forth and toggle between the application as needed. The enrollment process will be the next process we will discuss. We will discuss enrollment groups, how to use the enrollment group rules, which is basically the enroll or decline and waive option, organizational enrollment rules, which displays the current benefit information to the employee. We will review enrollment events as well. We will discuss an open enrollment and a life event, and we'll do this from the employee perspective. And then we'll also review the outcome from the benefits admin perspective. And within that, we'll also discuss enrollment rules and enrollment self-service, which includes uploading documentation and how to make sure an employee has access to the summary plan description. Here we have in the enrollment event setup, we have enrollment groups. And these enrollment groups are groups used to describe different benefits together and group them accordingly. So for example, it's easier to show you here. For example, if you have multiple dental plans, you may have a dental high qualified and a dental copay plan. You could have multiple plans within the one enrollment group. So from an employee perspective, if I'm going to enroll in dental, I will have these particular plans show all of the dental types together, and I'll have the option to waive or enroll in either a plan. And this is where the organization rules we discuss this setup here. So for example, there's a maximum plan of one, i.e. meaning you can only be enrolled in one plan. One plan is required. This helps to keep the employees from being able to pass through without enrolling in either a selection from the dental family plans. We have the contribution information and how this will display to the employee. And there's also additional information if you would like to customize to display to the employee, you can do that as well. This application gives you a lot of room for flexibility and customization for the employee perspective. And again, we have the plans that are included in the enrollment group. And here we have the enrollment rules or life events that utilize these groups. we have the enrollment events, and we have a list, as you can see, of multiple enrollment events here. And here we're looking at the marriage enrollment event. One huge highlight or enhancement with the GHR Benefits life events is, for example, in Lawson S3, once an employee submits the life event, the BN32 goes and, creates all of the deduction and enrollment first. And if they have a change, if they're still within their event period and they decide they have a change, it's a lot of manual work to reverse that change and make that edit from the benefits admin perspective. Versus in GHR Benefits, a good practice is to keep the event open until the last days of the event, because even if an employee submits their enrollment, they can always go back and edit. So they have the option to edit up until the last day of the event. And from a benefits perspective, you would finalize it towards that last day just to make sure they have plenty of time to go back and forth if they would need to make their different selection. And here we see the event period, the future benefit plan eligibility days, the employee display sections, which we will see. We will go through a marriage life event with an employee shortly. Documentation, if there's required documentation, and if you want this documentation to be approved prior to finalization, you have that option here. Here is just more so the setup of how you would like this information to be displayed to the employee, and any verbiage that you would like to key here, of course you can. And once again, we're circling back to the enrollment rules that we've previously discussed. And within the enrollment rules, of course, we know this determines how the benefits will display to the employee, the date, the pre-select date option. Of course, since this is a marriage, the benefits will be pre-selected based on what the employee is currently enrolled in. And here are other options to select as well. We discussed a bit about templates and email automation, and here I would like for you to see an example of the setup and how it's specified to this particular life event. So you can have multiple templates per different life events with the verbiage that's appropriate for that life event. And these are automatic emails here. As you can see, we have a create enrollment template, a submit enrollment template, and a finalize enrollment template as well. And additional can be added, of course, for started and submit pending and revert and inactivate. Here we have the enrollment display with verbiage that we will see this verbiage being displayed to the employee from the employee perspective as well. And anytime this information can be edited. And here we have our enrollment groups attached to the enrollment rule, attached to the life event. So everything is a domino effect and it's daisy chained together as it relates to the particular life event. And so here we see our medical, and here's a really good example of having multiple medical plans within one enrollment group. So for example, within this group, the employee will have the option to enroll in either copay, high deductible, or waive. Now I will change over to the employee perspective so that we can follow a life event together. Here under the navigation panel, I am using the employee role. As an employee, I have access to view my benefits, which shows what I am currently enrolled in and the contribution as well. I can view my dependents and beneficiaries. I can also have the option to add the dependents and beneficiaries. There is also a setting on the organization whether the dependents are confirmed or pending. and the benefits team has the option to confirm the eligible dependents and also reject the ineligible dependents as needed. Here we have the benefits enrollment, and this refers to the open enrollment. Currently, we have an open enrollment process that is active here, so the employee can see that as well. Here we have the life events, and we can see the historical life events as well. I want to also show you, before going into the life event, the benefits information. So for example, an employer is required to display a summary plan description to the employee, and they have that under the My Benefits information. And remember, we know that this document is attached to the plan itself, and we have that displayed here. And here we have a sample of what the employee would see once they select that benefits information package. Now we will review the life event again, and we will select marriage. Our event date is today. Here we see our life event details with our verbiage. See our attached documents being required here. So we're going to attach a document. Next, we have our instructions here. And our current benefits, as we discussed. Because this is a life event for marriage, you will only be able to change or edit current benefits, dependents, beneficiaries, and she has the option to add any beneficiaries here. For today's testing purposes, we will use Mr. Robert Jake. And now we are getting into the actual enrollment here. Here are our plan options. Of course, the automatically selected option is the option that she's currently enrolled in. Since she is married, we're going to select associate and spouse. She's adding Mr. Jake here. She has the option to enroll in the health savings account and or I decline, and we're going to decline. Vision will change to associate and spouse and enroll Mr. Robert. Dental, we will also change to the associate and spouse. Here we have our dependent care flexible spending account. We'll leave that the same. And we're going to decline spouse life and decline child life as well. And here we have our messages and our output here with our information, and typically the contributions displayed, for example, the medical. However, you can also see what happens if during the setup we have a contribution that is not there with the correct rates as well. So we can see it from the employee perspective and from the benefits admin perspective, just so you can check and double check if there's anything you need to change or anything you need to update as well. And we're going to submit this life event. Next, we will toggle back to the benefits perspective so that we can view the dashboard of the life event. And we're wanting to review the marriage life event. And as you see here, We have a lovely dashboard by life events or by all employees who are actually active within that life event. Documentation review, which we see that Ms. Jane is pending an approval. So this is a very good view. And then within that view, we have the enrollment process, all enrollment and enrollment exceptions as well. So we want to review Ms. Jane's enrollment life event here. And you also, from the benefits perspective during your testing, you can use the enrollment view, which shows it from the employee perspective, just as I displayed it to you guys. And here we see everything that they see, just to confirm. We see they received a confirmation email. We see the benefits enrollment information here as well. And here's the confirmation sheet as well. And so here, once we review that documentation from the life event perspective, we can confirm that documentation and refresh the screen. Okay, I apologize. I resent the confirmation document to her, which is something you can also see as well. And here we can approve that documentation on the actual life event, and we want to save. Now that we have approved the documentation, we would like to finalize the event. Now that the event has been finalized, we're going to roll into the maintenance process here, and we will toggle back over to the benefits perspective. So within the maintenance process, of course, you maintain your benefits. We'll review the jobs, the nightly processing jobs that automatically we set up to automatically run. We maintain the resource records and all of that good information. We'll do that under the maintenance process here. And as you can see on the navigational panel, we're going right down the line. We've reviewed the plans, we've reviewed the enrollment events, and we are now going into the maintenance. Within the maintenance, what you will see is a view from multiple perspectives of the same information, put in different ways. And I know we will discuss reporting as well, and I just want to notate that anything that is in a list view here can be exported out in Excel format or PDF format as well, or reports can be created from any of these views as well. So currently we're reviewing the maintenance by the benefit plans, and this will list all of our plans. Of course, this gives us everyone who is currently eligible, everyone currently enrolled, any future enrollment, and or any historical enrollments as well. For today's purpose, I would like to review by resources since we are working with one resource, Ms. Jane. Here's the list of her currently eligible her benefits that she is currently eligible. What you will see here is that at one point she had a 5-1 eligibility and then a 7-1 eligibility to 930. And then we have a 10-1 to 12-1. As she changes plans or as different things change on the employee's record, you'll have each eligibility enrollment status to track as well. So that is something good to use. Here we have her current enrollment, any of her future enrollments as well. Her historical enrollments, which we would expect to see from a historical perspective, her dental and her medical, because she changed the 2 plans on her life event that we have finalized. Her dependents and beneficiaries, any medical support order, flex credit. And here we also have every enrollment event that she has enrolled in. You see we have a draft of an open enrollment because currently the open enrollment event is open and she is eligible to participate in that event. Any measurement periods from an ACA perspective as well. I've selected the medical copay plan, and this is her historical record here because it ends on 11/30 based on our entry rules and our termination rules as well, and our change rules. Here we have an associate only, of course. We have the employee pre-tax, the employer portion of the plans, and our calendar year-to-date contributions for 2021. Of course, if you're interfacing payroll data or using the GHR payroll module, as you bring the payroll information over into GHR benefits, all of that information will display here for you to see readily available. Here we have the ACA reporting that is defaulting from the plan setup, as we know. Here, she did not have any dependents attached to her associates only plan, but she does have a dependent attached to the new plan, her new enrollment, rather. Here we have the contributions with our frequency table, and this is just reiterating all of the information from the plan setup. We have our standard deductions and any one-time deductions. Of course, if we're sending this information over from GHR benefits to Lawson S3 for payroll purposes, of course, we could create those one-time deductions here for that employee. Contribution history, this is, of course, what will display if we're bringing that payroll data back into the system. Any HIPAA transactions, which we know we tied the HIPAA transactions to the organization setup when we added those life events and associated those reasons there. So here we see her transactions and any documentation that she may have attached to this particular enrollment. Next, within the maintenance process, I would like to quickly show you the the jobs. Of course, we know them in Lawson as the BN 100 jobs that run our enrolling in our default or our mass creating eligibility and our resource updates. So here I've run the plan and I'll show you what the report looks like here. So here, of course, we're using as of date. Some of these reports do not require a date and they run static as of the day. Typical best practices to set this job up and let this job run nightly, and then the benefits team review any errors, if any at all. Here we would just, of course, add our benefit plans that we're creating the eligibility for here, and any benefit group that we would like to attach. For example, if it's a benefit full-time group, that is pretty much everyone eligible, we could add that group there as well. We would just submit that job. However, this job can be scheduled, so you don't have to come out there and do that every night. This would automatically run, and your output will be here waiting for you in the morning. Here we have an resource, and I removed his other date 1 because the plans are based on this date. So this is a good error that we would want to receive from a benefits perspective for this employee. So this is a really good example of some of the errors that we may be receiving. And there's another employee as well. And these error messages are really straightforward, and they're pretty easy to understand as to what you need to do next. The mass enroll in default plans is pretty similar. All of the benefit processes are going to look extremely similar. Of course, they're doing different jobs. If you do have a default plan or a basic life plan that is a default and everyone is enrolled, of course, you don't have to manually enroll everyone. You would select that benefit plan here and schedule this to run nightly as well. And any errors that you have seen on the mass create eligibility will display here for you. Resource updates. This is a good one. So for our resource updates, of course, when we have changes to the employee record, for example, termination or a change of FTE where an employee may go from ineligible to eligible or the opposite, this job will, of course, capture all of that information for you here. Here they also give you the option of selecting a benefit type, which is pretty easy and straightforward instead of adding a lot of plans in case you have more plans and fields we have here. And here are different options here. And here's our reasons that we can select to assign with that as well for reporting purposes. And of course, we would schedule this job to run nightly as well to capture any of the HR talent acquisition actions that may have been completed throughout the day. And we have our enrollment changes. I'm going to come back to the enrollment update tab here. Benefit plan updates. So say, for example, you realize I need to create a new contribution or I need to add an additional group to the plan, something specific that you would like to add. The plan will automatically display here in the benefit plan updates. The update hasn't happened, but this lets me know that there's been a change that has not taken place to the actual plan in the application. So here, of course, we would just create that report and run this update for that plan. What this will output is the existing results. So for example, if the premium will change, we'll get a full listing here of who those people are, what those premium changes are. It will give you the old and the new premium, which is pretty cool. And it gives you all of that information then that you can export out and have in a spreadsheet if you need it to review or validate. Other processes that are available that we won't go into detail about today is the ACA hours measurement. Of course, if you're bringing over your hours worked and you have your measurements and your measurement period set up and everything and set up in GHR Benefits, you can review all of that information here and run your processes if you run it monthly or biweekly to capture any of those ALE members as needed there. That information is similar to COBRA participants. If you are utilizing COBRA within your organization, you have all of that information here, able to create reports and use your adjustment reviews for your COBRA processing needs here. So from a maintenance perspective, we have discussed the benefit plans, how to view the different resource data, keeping in mind that we can create reports off of any of the list view and the different views that we have, the main related processes as well. Next, we will discuss the reports and utilities, and I will be brief as to let time allow for questions. Reports are probably the best enhancement within the GHR module. Lawson does give good reports, but you find yourself writing a SQL or different queries to pull the information out. And you want that information dynamic. You know, sometimes it's cumbersome to run these reports and create the reports for specific information that you may need. However, GHR Benefits has done an outstanding job with reports, and every screen is a report in essence. For example, we see here the same view that we typically saw from the maintenance perspective on the navigation panel here. So here we see the benefit plans listed, and we see dependent benefits and the contribution history. So if you do have the contribution history with the payroll, you can export this out in PDF and or CSV. We have the list of dependent benefits here as well. We have reports by resources. So if we only wanted to look at Jane and her dependent benefits, we could see that here from a historical perspective. We could see her beneficiaries, her time, her standard time records, her one-time deductions, her deductions, all of those codes there, any hours worked. There's quite a bit of information here, as you can see as I continue to select what's next. Compensation history, vesting history, vesting report. The information is endless, inaccessible, very, very easily accessible. You can see if they're an ALE member for the ACA purposes, you can see the ACA hours, the offers, everything with ACA benefit group membership, which is something we discussed early on in the conversation. Here we see this information reiterated again on her record, and I could export this information out for reporting purposes. And of course, we see here dependent benefits. So if we only wanted to look at dependent benefits, that we could also review that information. And there are filters as well. So if I only wanted to see dental health or disability, and I only want to get a list of those dependents, we can see that here. Another really, really cool tool within the reporting is I'm missing some information here. I would like an additional tab that gives me the dependent social security number, or is the dependent pending, or the dependent status, for example. We could always come out here and create a report and edit that report and add additional fields. So adding additional columns here, we could add as well on any of these forms. And I'll show you a report that was created. So for example, if I went to one of those screens and I was like, hey, I want to create me a report, so I could always just have it in my personal report. I'll show you one here. So here we have a benefit enrollment list, and it has a little bit more information as we've added a few more columns here. However, if I also did not necessarily want to share this report with, if I don't want to share this report with everyone, you have the options to change it from public to a specific group. Say you want to change it to the benefits team, you have that option as well to define, or if you only want to review the report to yourself, you have that option as well here. And one other good tool that I would like to discuss really quick is Spreadsheet Designer. I know within Lawson we use add-ins, and sometimes it's really tricky to manipulate and use, and saving the report can be a little daunting with the task. However, with Spreadsheet Designer, it is much more user-friendly. The information is easily accessible, and if time permitted, I would definitely display that to you guys, but it is a great tool used, and it can be saved, filtered as of dates. You could reverse back and report on data as of last year at this certain point in time. So that's also a nice, really nice tool and change. I believe that is all I have time to cover today. That was a lot of information, and I'm going to open the floor for questions.
Thanks, Brittany. We do have a few questions. I'll just go through them in order. The first one was, does GHR benefits allow for external facing open enrollment? So public internet. I think in this case, that's delivered functionality out of the box. Okay. Second one, do you have ability to limit the election options based on dependencies?
Repeat the question, I'm sorry.
Do you have ability to limit the election options based on dependencies? For example, you should not get an option to elect a health savings account unless you have the high deductible health plan.
Yes, yes. I'll show you really quick, yes. And I was trying to answer your first question. I was definitely on mute. To answer your first question, yes. The answer to that question is yes. I do believe there's a little security setup and a little technical setup that you may have to do as far as within your firewall and different things like that within the organization. But yes, that is, yes, they can do open enrollment outside. Here we have prerequisite plans and restricted plans. So for example, like the question stated there, I'm not allowed to enroll in a certain plan if I didn't, select the other. A lot of times you see that with life, if you're not enrolled in the employee life plan, the spouse life plan, it would be a prerequisite on the spouse life plan. So yes.
Okay, and then second part to that one is also, can the employee view benefit deductions that may not be tied to a benefit plan? For example, a voluntary benefit such as ID theft premium?
And it's not attached to a benefit plan?
Yeah, that may not be tied to a benefit plan.
Right. I will need to review that one and see. I believe there is a place for it, but I'll review and follow up. Jake, if you could get the person's contact information, I will review that answer and follow up.
Okay. Let's see here. Another one. Can you leave life events and new hire enrollment open during open enrollment? I know that was an issue in S3 benefits.
Yes. For example, here, let's go to our employee perspective. So for example, here, so we have an open enrollment right now that's set up and is active. However, the employee still has access to all life events at the same time. So here, the benefits enrollment is the open enrollment process, but they do still have access to the life events, yes.
Okay, here's another one. We implemented life events, however, we ran into issues with effective dates of benefit changes. From our understanding, the event date entered by the employee drives the benefit start and stop dates. We find that employees frequently enter the wrong date. Is the benefits administrator able to change the event date if it is incorrectly entered by the employee?
Yes, they can change the event date. And they can change the event date from multiple places. For example, if the enrollment, I need to find one that's in draft status really quick so I can show you. We'll do this one. So here is this event. Okay, we can change this date here. Now, the rules of the enrollment event are based on the date that they enter. So for example, if they enter a date that they were divorced yesterday, the event rules would determine, okay, which date, is based on that in the previous setup. However, the benefits admin, as I'm in the role here, can come and change the actual life event dates. And they may just need to adjust the dates that are on the enrollment rules attached to that life event to get it to come out the way that they want it to. They may just need to force in a date on their life event rules.
Okay, perfect, thank you. And then the last question, is there a time version update that benefits will no longer be available in S3? So I think Infor is, their sunset date for version 10 or S3 Lawson is April of 2026. It's not a decommission date, it's just the end of support date. Looks like we had one more come in. Where are documents that the participant uploads stored?
The documents that the participant upload are stored. Look at our person here. I know they're stored on the life event, but they are stored somewhere else because the life event never goes away, so you always have that documentation that's attached to the life event. But I'll double check. There is another place in the system that you also have access to that documentation information, and I'll follow up with you as well. But I know they're stored on the life event themselves.
Okay, great. I don't think we have any other questions. Like I mentioned at the beginning of this webinar, if anyone has any specific questions or anything specifically you'd like to see in a demo, please do reach out to us. We're happy to set up a demo to dig into whatever that you guys would like to see. And that goes for benefits or anything Infor related. If you guys are looking at anything in 2022 and are needing help planning or demoing, please do not hesitate to reach out. But yeah, thank you everyone for joining, and I will follow up in the next day or two with an email that has this presentation and a link to the replay of this webinar. Thank you and have a great day.
Thank you.